And then I'm kind of curious to kind of go down the row and hear people's experiences with patients that come in to see you and then they leave a week, 10 days later or so, and trying to deal with kind of complications remotely. We'll start down here. Any experiences with that or thoughts about keeping in touch with patients or their providers?
We keep touch with patients regularly, usually calling and following up, starting on day 1 and day 2, and then have regularly scheduled post-op visits that were scheduled before the procedures, so that we make sure that follow-up is made and we can catch anything if anything's running amiss. But patients usually do well.
Dr. Volstein?
About 70% of the patients that come to our practice come from probably over 100 miles away. So we had to set up multiple points of, so to speak. First of all, majority of the surgery we do in a hospital. Second is, on every case, I bring the internal medicine physician with specialty training and metabolic medicine who actually manages the patient in parallel with me. We've seen patients with brain aneurysm, pituitary injury, trauma, or tumors, rare bleeding disorders, all were diagnosed incidentally after the surgery, and then the primary care doctor brings the specialist on board during their hospital visit. After the surgery, the patients are required to stay for about a week in the area. They stay 24 hours mandatory in the hospital. If they need to stay longer, they can. If the hospital fusses, and commonly they do, we have arrangements with rehab hospital right next door, and the patients have ability to pay cash. I think we negotiated a rate of about $250 per night, which includes food, nursing care, and everything else. And then we have Zoom meetings, so they come back to the office at 1 week point. Usually we address most issues, and then they come back for the Zoom meeting if they need to. 1 week, 3 weeks, 1.5 months, 2 months, and then before the next surgery. Also, we have an electronic patient monitoring system using AI. So basically, on a scheduled basis, the patients get text messages and training videos. For example, on day 2, they get the video, a small video, and they get a text message saying, hey, you should be feeling this, you should be noting this. If this happens, let the nurse know. And we have those benchmarks extending for about 2 months. So we try to use that as the communication module.
Wow, that's pretty robust. Great.
Oh, very similar to Boris. Most of our patients are out of town. We can do things in the hospital. We have a skilled nurse facility that people can stay at. Usually for bigger cases, they stay in town for at least a week. If anything major is going to happen, it's going to be in the first few days. And then there are the things that can happen after the first week or so. All my patients have my phone number. I don't have anybody in between. Any issue, they're texting me. They're sending me pictures every week. We can follow it very closely. The problem is, if you go back to your community, some doctors may not want to touch you because they don't know what lipedema is. And I've heard ridiculous things from radiologists who have asked to put a needle in. They send them to the Mayo Clinic. We don't know what this is, so the patients just drive back and I take care of it. But make sure you have your primary care doctor at least knows that you're doing this, and your surgeon can maybe talk to the primary care doctor in the unlikely event something's needed.
I think we're doing a lot of the same things. I think that the key is to start off with transparency and just let patients know if you're traveling for surgery that it's going to be potentially more problematic if you do have a complication. We have every patient stay a minimum of 7 to 10 days. We ask them to get open-ended tickets because if we're at day 7 or 8 and we're not happy with how they look, we let them know up front you may be asked to stay longer. And we always make a point of contacting all the primary care doctors as part of their medical clearance to establish that relationship, to let them know exactly what we're doing, what they can expect. We provide our notes so that we feel like we're part of a continuum of care, so that we bring them in early as opposed to the first contact being at the point of managing a complication.
Like some of the other doctors, the majority of our patients are from out of state. And fortunately, I'm doing surgeries in Florida, which sets a limit of 4 liters of fat removal. and it's an outpatient setting, so we don't keep patients in the hospital, but with the smaller volumes, the patients are actually very mobile and doing very well right from the beginning. We see them the next day. I also give them, every patient, my cell phone, so they have direct contact with me, and they're encouraged to let us know if there's a problem. The most common complication that may occur would be a seroma. Oftentimes that can be taken care of just with some extra wrapping. However, if they need a drain, we fly them back in, and we pay for their airfare, and so it's not a hardship on them. But they have to take the day out, and so that's how we manage it.
Like everyone else, most of our patients from out of state, and so I have a question. If all of us are in different states and all of our patients are from out of state, are each of our patients going to each other? Just a question. We do the same thing. We have aftercare nursing, and we have patients who are in for just liposuction, stay 3 to 4 days post-op or longer if needed, but usually we feel they're okay to go home on the 3rd or 4th post-op day. If they're having skin removal, we have them stay a week and longer, maybe a week to 10 days. A lot of those sutures or surgeries, I use a skin layer that is removed at 7 days. And with abdominoplasties, the only surgery that we use drains, that they may last up to a week or so. And then everyone has my cell phone number and Christina's phone number. We're in constant contact with people, or frequent contact. They can always reach us. I have had people had to come back for things like seroma sac in an abdomen, for example. And we have spoken to physicians or surgeons in other states, but as Dr. Katowski pointed out, most docs don't want to take care of other people's problems. So we have had patients come back, but we're always available in the event that that's necessary.
And thank you guys for taking care of all my complications when they go out to your areas. Thank you very much. After the complications talk, I definitely need a happy hour, so thank you very much for enjoying this panel. If you have any questions, please feel free to come up to us. Have a good night.